I see we have several people here, and welcome. We're glad to have you. Uh, our presentation is Self-Care for Student Counselors, Normalizing Help Seeking and Integrating with Professional Identity. So just confirm you're in the right presentation that you're looking for. My name is Melody Weber, and I'm joined by my co-presenter, Dr. Goodrich, who will introduce herself in a moment. I'm currently a doctoral student in counselor education and supervision at Loyola University, Maryland. And I'm working on my dissertation right now. Very excited to have just completed analyzing my data, which is an exciting time to get to. And self-care for student counselors has been an interest of mine throughout my clinical education, and it's evident in my research as well. So a piece of what I've looked at in my dissertation relates to student counselors is the population, and self-care is one of the aspects of their experience that I've looked at. So I'm just excited to share some of the literature and also some practical guidance and explore these topics with you all today. So I am really thinking, in light of everything going on, that this is such a timely topic that we've chosen, because as you're adjusting, I know many of you stated in the comments as we were coming in that you're students and some of you are counselor educators, and you probably have experienced some level of disruption in your day-to-day life as a result of everything happening with COVID-19 and everything switching, either switching to virtual or moving to an even more on virtual than what was already occurring in your life. I've had more meetings somehow in the last 2 weeks than the previous month, but they're all via Zoom or other means. So it's a good time to regroup and think about your self-care as we're dealing with the upheaval that's going on from our routines. So thank you for joining. We're glad to have you here. We're excited to explore, and I'll turn it over to Dr. Goodrich to also introduce herself before we get started.
Thank you. So as Ms. Weber said, I am a counselor educator, as her co-presenter, work in a small liberal arts university in the Southeast and have been a counselor educator for several years. And so the topic of student wellness is particularly important to me. And was really excited to be able to partner on this because I know that this literature is important for us to look at. I know the practices that we do are really important in a formational way when we're starting out as professionals. And even as we continue throughout our profession, our own wellness, our own health is an important part of our work. So we're just delighted to have you with us and that we can have some discussion around this topic today.
So we just want to get started. Thanks, Dr. Goodrich. We want to review the goals for this session, what we hope you leave this presentation thinking about or being more informed about. And number one, we want to discuss self-care and its benefits, specifically with an eye for counseling students. But if you are an educator, if you're a clinician, you'll find some of these takeaways relevant too. We're also going to explore the concept of help seeking, which can be related to self-care and the barriers that students might encounter that limit their ability to engage in self-care or in help seeking. And then we also want to review how self-care and help-seeking practices can be destigmatized, and we'll get into how there might be stigma around these concepts in a little bit, and also how those involved in the education of future clinicians and future counselors, what they can do to support self-care and help-seeking for students. So to get started, we just want to review a definition of self-care that's going to guide our understanding. As clinicians, as student counselors, as others in helping professions, you likely have some idea of what self-care is, but just to get us all on the same page of what exactly we're talking about today, we're going to use this definition presented by Williams et al. 2010. And they define self-care as the actions that one takes to lessen the amount of stress, anxiety, or emotional reaction experienced when working with clients. And this is a helpful definition of self-care because it reminds us what the primary function of self-care is for the clinician, and that's to prevent us from becoming overburdened by the stressors of working with clients that can take a toll on our lives as helpers, both in the professional role and outside of that role. And so along these lines, self-care is often discussed in the clinical literature as a key way of avoiding burnout or other forms of clinical impairment like secondary trauma. And it's also important to note that in addition to helping to prevent burnout, there's another side to that coin, that self-care also can support counselors' overall wellness. And particularly this is true when individual self-care addresses multiple areas of their wellness. So not just exercising for physical self-care, but also engaging in things that support your emotional self-care. You're going to see a holistic benefit from attending to these different areas. So although it's helpful to think of self-care as a way to prevent our stress responses from declining into burnout, if we only talk about self-care as a way to avoid worries about impairment, we might not fully be capturing the essence of what self-care looks like, because it also can support the wellness and resilience of clinicians and student counselors. And that's something we're really going to talk about today, because choosing to only discuss self-care in a manner that focuses on avoiding burnout might actually contribute to stigma surrounding conversations that are honest about the ways we might fall short in these areas. And we're going to return to this idea more throughout the presentation. We also want to define help seeking for you all today, because it might not be talked about quite as often as self-care, but it is related, and especially when we're talking about student counselors, it's an important concept to understand. So help seeking is identified as seeking assistance from anyone. This can include friends, family members, clergy members, and mental health professionals. And it's generally used in regard to a particular issue that's already been identified, an individual seeking help, seeking clarity, seeking understanding about how to address that particular issue. So for example, help seeking for student counselors in particular might arise when a supervisor notices that countertransference might be arising in session with clients, and that supervisor might then suggest to the counselor, the student counselor, that they seek personal therapy. That's a form of help seeking. And as we'll talk about some more, that's often the most common form of help seeking that's talked about for student counselors, that of seeking their own personal therapy to address things that might be coming up. And similar to as I mentioned about in my discussion of self-care, help seeking is often associated with an issue already being identified, and that's when it's talked about a lot. So that association alone could influence some stigma that students or counselors might experience about engaging in help-seeking behavior. And we'll talk about each of these some more. That's going to unfold throughout the presentation. But first, we're also going to do a brief review about burnout so that we can see how these different concepts align.
So taking a look at burnout can help us, because we know this is part of the way that the conversation is sometimes framed. And when we look at investigation into burnout, we know the investigations in the literature have been going on for some decades and have been refined over time as researchers delve into this. We find that the construct of burnout really has three identifiable contributing areas, and those include exhaustion. So this sense of being depleted, worn out, really tired. We see this frequently when folks are experiencing burnout. We also can see cynicism as being another indicator that burnout is occurring. So often when folks enter into the mental health fields, they're idealistic, they're energetic, eager to connect with clients, high sense of empathy toward other folks. And we see this begin to wane when folks are experiencing burnout. So there begins to be maybe a negativity towards our clients or a lost sense of idealism. As those things begin to creep into a greater and greater degree, we can acknowledge that burnout may be a part of what's occurring. Another contributor or another factor that's part of the experience of burnout is inefficacy. So when folks are experiencing reduced productivity, a low morale, really have this sense of not being able to accomplish things maybe that they've been able to accomplish in the past, that inefficacy can also be an indicator that burnout is occurring. And we do see this discussion frequently when we're talking about self-care that can be framed in the sense of burnout prevention and trying to avoid that sense of impairment. It's interesting when looking at studies of folks who are practitioners in mental health fields across a variety of of mental health professionals, there are many that experience signs and symptoms of burnout. So that may vary across the population, but it's not a rare occurrence. It's something that we know a lot of folks have struggled with to varying degrees. So it is important for us to pay attention to that aspect here. Also, we do want to acknowledge, and we will return to this a little later in the presentation again, that while burnout may have some personal elements to it, maybe we're personally overloaded, or maybe we've got some things going on in some of our cognitive styles that are contributing to that. It's important not to ignore that there are systemic issues that can also contribute to burnout. So if we are practicing or working within systems or organizations that have a leadership style that's not inclusive, or we feel like our feedback is not really being included into the process of how our work is framed and walked out, that can be important for us. So we want to pay attention to both the personal and the broader systems issues that are occurring. Since we are looking at students, we want to look at how burnout may relate to students as well. So there's some interesting things that are going on here, and please feel free to hit the chat if you are one of those students that's experiencing some of this right now. If you think of some things that might be helpful to share with the group. We recognize that the majority of graduate students are juggling a lot of different roles. So many students have the responsibilities and all the work that goes along with both academic and clinical pursuits. And those certainly are not minor undertakings when you're entering into a graduate program. That's a major commitment. In addition to that, we recognize that many graduate students are also working part-time or full-time. They have family roles and responsibilities that they fulfill. Many times students are volunteering or involved in other organizations. So many things that are going on there. We want to be sure to acknowledge that. There have been some studies that have looked at student burnout, and in both counseling students and in psychology students, so kind of trying to look across the mental health professions here. And a number of students have indicated in some qualitative studies that they were either at risk of burning out or felt like they were burning out, or showed at least one subscale there looking at those ideas of cynicism or exhaustion or inefficacy, that they were experiencing those things even as students. So we want to pay attention to this, not just as an issue that we think could face practitioners later who are maybe working with a difficult client population or in a difficult setting, but it's also something that students as well are experiencing. So we want to be sure to include that. As we're talking about students and our self-care and our professional identity, we want to look kind of at some of the ethical pieces that go with that. And I can see some acknowledging here going on with some of our students that are here in the chat. There's quite a bit of work. And this is kind of interesting. I'm going to go as an aside on the chat here. I think you're making a great point, Kaylin, about all this additional work. I think one of the things that seems to have happened just in our present situation, and you know, folks who are maybe watching this later will remember this time period in history. Seems like a lot of folks either are struggling with issues of loss of work, but those who are working or who have kids at home have an elevated amount of work. So they're working more, they're learning new skills, all those things are going on. So we want to definitely acknowledge that. As we talk about students and practitioners also and educators being professionals in the field, we do want to acknowledge the role that our professional associations and our professional identities play here. So we're looking at some of the ethics code, and we've put these in a PowerPoint, and I'm going to just go ahead and read them as well as we draw our attention to these things, because they are an important part of developing our professional identity. So if we look at the ACA ethics code, in the introduction to section C specifically addresses professional responsibility. And that includes the statement, in addition, counselors engage in self-care activities to maintain and promote their own emotional, physical, mental, and spiritual well-being to best meet their professional responsibilities. So this is kind of an introductory statement framing the conversation about our self-care, and that this is something that is wellness focused for us to be at our best. When we look at some specific parts of the code, if we go to C2G, counselors monitor themselves for signs of impairment from their own physical, mental, or emotional problems and refrain from offering or providing professional services when impaired. So we see that, kind of burnout piece there. They seek assistance for problems that reach the level of professional impairment, and if necessary, they limit, suspend, or terminate their professional responsibilities until it is determined that they may safely resume their work. Counselors assist colleagues or supervisors in recognizing their own professional impairment and provide consultation and assistance when warranted with colleagues or supervisors showing signs of impairment, and intervene as appropriate to prevent imminent harm to clients. So we can see that this is a responsibility that we have as practitioners, both for ourselves to be self-monitoring, as well as to be working with colleagues for their overall welfare and the welfare of their clients. Then moving on to students. So being counselor educators, working with people who are future mental health professionals, this is important to us as well. So in the code referring specifically to students and supervisees monitor themselves for signs of impairment from their own physical, mental, or emotional problems, and refrain from offering or providing professional services when such impairment is likely to harm a client or others. They notify their faculty and or supervisors and seek assistance for problems that reach the level of professional impairment. And if necessary, they limit, suspend, or terminate their professional responsibilities until it is determined that they may safely resume their work. And I want to just pause here for a second. We're going to look some more at some codes, but and we'll return to this in a bit. That can be an additional pressure to students, because as students are focused on completing their clinical work so that they can be fully prepared as practitioners, if they're finding that there's something that's interrupting in that process or is impairing that process, that really can be a weighty experience, because while self-care and wellness is important, the goal of finishing school so that you can practice your profession also is important. So we'll get into that a little bit more, but we want to recognize the conflict that could potentially be there for folks. Looking at the APA as well, related to competence, particularly in 206 subpart B, when psychologists become aware of personal problems that may interfere with their performing work-related duties adequately, they take appropriate measures such as obtaining professional consultation or assistance, and determine when they should limit, suspend, or terminate their work-related duties. Being inclusive of mental health professions, we've also looked at AAMFT, so their ethics code, looking at professional competence. Under the area of seeking assistance, marriage and family therapists seek appropriate professional assistance for issues that may impair work performance or clinical judgment. So we're seeing that this is not limited to any one particular area of the mental health field, but that across different areas of mental health work, different professional associations, this idea of wellness and health, so that we are able to properly care for our clients. And we would also add as well, properly care for our students is an important thing that we want to include there.
And we also want to take note of recommendations from across the field, not just those that are recommended by our ethical guidelines and the professional associations that we align with, but also what is the practical information we've been provided from different books and other resources that have been provided to help us apply these principles to day-to-day life. So we put a few resources there. In the last couple of decades, we've seen this topic receiving more and more attention. And there's just a few here. In 2018, the ACA published Self-Care for Counselors by Corey et al. Wicks 2008, The Resilient Clinician, are both resources that take a look at how do we engage in self-care, how do we integrate this principle into our practice and our lives. And I see you all coming into the chat and saying, even in these times, we're experiencing even more threats to being able to be well because there's such challenges or experiences you had when you started your counseling journey and noticing that lack of empathy that might have come up from being burned out or experiencing some tension in these areas. So if you have a couple suggestions, we'd love to check in, pop into the chat, and let us know what professional resources have been supportive to you during this time.
Yeah, and I'm noticing and appreciating in the chat, some people have said, hey, I've experienced some things like this. And it can sometimes be hard to notice in ourselves. There can sometimes be these experiences that kind of wake us up a little bit. We think, oh, I'm noticing something's going on with me.
Yeah, it's so great to remember that and to communicate with others who have a similar experience, because that's part of how we do minimize stigma that might be experienced. Mm-hmm. So Maria, thank you for sharing that Military One source has free counseling. So that's a wonderful resource to be able to avail yourself to. Mm-hmm. And we're going to continue onward, but there'll be some other places to check in. So if you don't have something right now, but think of it as we continue, definitely pop into the chat and share that. Mm-hmm.
All right, so as we look further at some things related to student clinical training, which is also an area that's important here to us, we see in some of our professional associations, not just looking at the ethics code, but like ACES, the Association for Counselor Education and Supervision, it's a division of the ACA that you may be familiar with, has best practices in clinical supervision. And they indicate that it's important for ethical supervisors both to attend to their own self-care, that's part of the modeling process for their supervisees, helps the supervisors to remain healthy and well, and helps them to work effectively and encourage their supervisees also in engaging in that self-care piece. Also, if we look at CACREP, the Council for the Accreditation of Counseling and Related Programs, and look at their accreditation standards, there's a couple of different places where they really emphasize this importance of wellness and self-care in different ways. When we look at the first area of standards that talks about the institution, the academic unit, that houses counselor education programs, there's a specific mention that referral services for mental health assistance should be made available to students, so that if students are needing some additional care, they have some resources for knowing how to access that. Also, when we look at the curricular standards, so the things that actually need to go into the process of teaching and learning, it's also specifically addressed there in the curriculum that self-care strategies should be discussed with students, provided to students throughout their counselor education training. So that's an important part of that professional identity piece for counselors and counselors that are currently in their training as well. Also, we see in various places with the APA, when we're looking at the field of psychology, self-care is also addressed in terms of mentioning the importance of resources for students who might have a variety of personal needs and need the referrals to various resources to help with that. So it's an important piece in students' training.
So not only is self-care important for current clinicians, but as is evidenced by those standards we just reviewed, maintaining a focus on self-care as a part of training of future clinicians is especially relevant, because students establish habits during their learning years that inform them for years to come throughout their practice. And it's a key piece of their counselor identity formation to include this consideration about self-care. And for student counselors, for many who are practicing right now, it can be very easy to say, I'm too busy to attend to my self-care. We've seen in the comments, you all are very busy. You have a lot on your plate. And it's demanding, and it's hard to attend to self-care when all of that is going on. But the reality is, unfortunately, we're always overloaded like that, and we have to find time for self-care, because if we don't make time for it, we'll never get to attend to it. There's a sobering but very accurate quote that I bring up in many conversations about self-care, and it's from wellness educator Joyce Sunada. And she said, if you do not make time for your wellness, you will be forced to make time for your illness. And that's the reality, is if we push ourselves for too long, too hard, eventually our body will say, that's it, you're stopping. So our goal is to be an encouragement to you today, to say, take time for your self-care, encourage your students to take time for self-care so that you don't reach that point where you are impaired and have to take a complete step away. It's also important that we remember to pair our self-care goals and practices with self-compassion. There are so many wonderful self-compassion resources from Kristen Neff. If you get the opportunity to look into that, it's adjacent to self-care in many ways, because we can set these lofty goals for self-care that will work out 30 minutes every single day. But if we're not working out at all, that's probably not a very good way to set a goal, because we may fail and then we lose motivation. So it's better to then say, I'll walk 3 times a week and work ourselves up to a habit that we can maintain, because that will ultimately bring more benefit than doing nothing or from stop starting. So beyond these practical concerns about how to implement self-care in our lives, there's also been some research into the benefits of self-care. And that's helpful because we can see the experiential impact that's been experienced from a variety of populations. So because we're focusing on students in particular, we wanted to look at what has been examined through the research in regard to counseling student or other clinical student self-care. One great resource is Coleman et al.'s meta-analysis study. And overall, they studied the self-care practices of psychology graduate students. And they found that various self-care practices, including social support, practicing mindfulness, or a mixture of different self-care activities, across studies, there was generally a positive outcome for engaging in self-care, such as lowered anxiety, at times increased stress tolerance was identified. And this is good. It's great when the research lines up with what's talked about in the field, what's emphasized, the definitions we use. When we see that alignment, it's encouraging, because that shows us that engaging in self-care does have a positive impact. As I mentioned earlier in this presentation, help seeking is related to these self-care concerns, but it does tend to be actions that are specifically in relation to an issue that's already been identified. And an emphasis on help seeking should also take place as a part of the way we talk about self-care, especially when we're talking about student self-care. The way clinical programs talk about self-care and help seeking is going to make a difference. So there are different types of help seeking, as noted in the definition. It might include personal therapy, it might include social support, or engaging within your particular faith community or spiritual tradition. And we're going to talk about how these concepts relate specifically to counselor education and how we might empower counseling students to engage in these behaviors in a bit. But first, we do want to acknowledge that there are barriers for students. Some of these we've already hit on. Some of these you guys have brought out so well in the conversation. But part of the barrier is you're busy, and there's a lot of limitations to being able to attend to your self-care. We also want to acknowledge that helpers, even though they're learning how to be a helper themselves, sometimes clinicians and student counselors might experience stigma related to having to be the one to help for self-care needs, for issues that are arising. And I want to clarify that this sense of a stigma about seeking help can be influenced by personal appraisals. This could be self-talk like, I should be able to deal with this. I'm a counselor, I've been trained, and perhaps bringing a higher standard for yourself than you would place on someone else. And it can also be influenced by external factors like the culture of the program that you're in, if you're a student counselor, the internship site, or the clinical place that you work, if you're working already as a professional. Or other systemic factors can influence the way we look at asking for help or seeking out help when we're serving as a counselor, when we're learning to be a counselor. And an example of this concept is evident in Mullen and Crow 2017. They looked at school counselors and examined their help-seeking behaviors. And they found that those who experienced a greater level of self-stigma related to seeking mental health services also engaged in fewer help-seeking services. So measurement of stigma in this study looked at how participants might appraise themselves if they noticed they were experiencing a mental health concern, such as feelings of inadequacy, that they might have for having such an experience when they're trying to help others who experience similar things. Those participants who did indicate a higher level of help seeking also reported that they were experiencing lower stress and less burnout. So this study is correlational. We can't necessarily infer a cause and effect. We don't know what was causing these behaviors or which was the cause and which was the result. But we can get an idea that for this population, these experiences were running together. So those who were more open to help seeking, engaged in the help seeking, and also had less stress and less burnout. So if those things are running together, it's a good reminder that we as helpers are not above also needing help. And that although we might have some self-talk that might be negative about this experience, it's a common need across helpers, and it's okay to do so if you need help. And another piece to the issue of stigma related to self-care and help seeking
Hey, Ashley.
has to do with the way that
Okay.
counselor programs are addressing these.
Okay. Hey, I've been trying to.
Please mute yourselves.
Thanks, Jennifer. I was able to put it in, I think. So the way a program's culture talks about self-care is going to inform the self-care and help-seeking of the students in the program. So an example is if a program speaks in reactive terms a lot about self-care, only when there's an issue is it brought up, it's going to be very easy for those students to not emphasize when they do need help, because then it's kind of associated with a problem. So one way to assess how programs are handling this, Bamonti looked at the program handbook for psychology graduate programs. And they looked to see how many of these handbooks, they looked at 136, and they wanted to know how many addressed self-care and how they did. So 56 of the 136 actually addressed self-care in some way. And those 56, the most common way they addressed self-care was through conversation about help seeking. So stating to students in the handbook that if they were impaired, they needed to seek personal therapy. And overall self-care during non-impaired states, this idea of the other side of self-care that we're talking about as a support towards wellness, was hardly discussed at all in these handbooks. So we don't know these programs. We don't know what the faculty individually or in their classes and supervision might have been doing to address self-care at a smaller level. But it does give us a chance to pause and think about if we're working in counselor education or if we're looking as a student at our program with kind of a critical eye, not in a mean way, but in a way to be curious and saying, how are we informing ourselves about self-care and how are we talking about it in a way that we're setting ourselves up for success? So here's another great chance for us to check in. If you work as a counselor educator or even as a student, what are barriers to self-care that you might encounter related to some of this potential for stigma that we've addressed or in other ways? I'm just going to pause and give you guys a chance to pop into the chat for that. Yeah, so the graduate student time is such a restriction because there's so much that does demand your time. It's very easy to feel or to experience a lack of those hours that you might need. Financial, that is a huge one. And yes, insurance, when it comes to if the health seeking or seeking personal therapy, insurance can be a huge barrier. What is covered, what isn't, and if you have access to insurance. Mental health diagnosis, yes. We are not exempt from these experiences because we're helpers. So it's easy to have symptoms arise or different things trigger those symptoms to come up. Expectations, yes. If you're working right now with clients, there's a lot of expectations from switching to virtual and in other realms as well, and how you manage and navigate that in addition to everything else. Yes, the capacity. Yes, if a student appears inadequate to be serving. Family involvement. These are all so real. And we just thank you all for sharing these barriers that people encounter. And that's why, along with a lot of what's in this presentation, you do have to look at the specific situation and try to tailor response to those as much as possible, because your life is different than everyone else's. So when you're looking at your self-care, it may look different but you can draw from recommendations of others to try to integrate these things into your life. So we're going to keep moving along, but there'll be some more chances to check in before we wrap up. And we want to switch gears a little bit now that we've discussed self-care and help seeking, to think about how programs and faculty members and supervisors might support students in their self-care practice and in their help seeking behavior. So we're going to first focus on those faculty who serve as supervisors. Supervision provides a great opportunity to spend time with students that is a smaller group environment, and it gives you the chance to check in with students about these experiences and these topics in a way that might be easier than if you're talking to a class of 20, 30 students at a time. So Thompson et al. 2011 conducted a qualitative study, and they interviewed 13 counselors in training who were currently completing their practicum and internship. And they wanted to understand their thoughts about self-care, but also what had informed their ideas about self-care. And the participants emphasized how their supervisory relationships through their institution had assisted them in developing their self-care strategies because they emphasized the importance of self-care. This was done explicitly through check-ins about self-care and creating an environment of supervision that was attentive to self-care. When I supervise master's students, I like to start off with a self-care check-in during our supervision time. And this was a great opportunity to lay the foundation for honest conversation about what was difficult, what was working, and how to set up for self-care success. The implicit actions of supervisors in this study were also supportive of self-care. The participants identified that discussions with their supervisors and seeing them explore supervision in a holistic manner that attended not only to the client and the information about the case, but to the supervisee's experiences, these students found that to be really helpful. We're also going to look at faculty in general who may not be serving as supervisors, and Dr. Goodrich is going to share a little bit more about what can be done through that relationship.
It's important for faculty to keep in mind that there's the modeling piece, and that includes both behavior as well as attitudes. So when faculty tend to have positive attitudes toward maintaining self-care practices and they're open about that, and when faculty show positive attitudes toward personal therapy, that seems to be reflected in students' attitudes toward therapy and toward self-care practices. So there's important modeling both in behavior and in the way that we frame and understand and contextualize self-care. In looking at some responses from students from a couple of different programs informally, it was interesting to see that students note that faculty and supervisors are important examples for self-care. Most of those tended to be positive, but one thing that students respond is that sometimes faculty can take on too many responsibilities. So when faculty or supervisors become overburdened, then that can indirectly impact students because of overworking choices that folks may make. Now, certainly in the present situation that we're in, we have a lot of folks that are ramping up to gather some new skills, to learn new ways of doing things. And so we recognize that that could be a particular challenge at present, but it is a good thing for faculty and for people who take on that supervision role to keep in mind that while there's going to be some individual differences in what self-care and health looks like for folks, that modeling piece really is multifaceted and an important thing for us to continue to nourish with ourselves and with our students as well.
And I think another piece to keep in mind with modeling, with self-care, with understanding that there are times that it gets crazy, is the concept of seasons. I think you can make the adjustment in your mind, and you can model that there are seasons that are going to be a little busy, that your threshold for self-care might be a little tighter. And that's the reality of living. There are times that everything seems to go crazy. It's like the tides. They're consistent in that they rise and they fall. But yet individual waves are inconsistent and hard sometimes to predict when you're just experiencing them. And so it's adjusting to the tides and knowing that those are there. So sometimes there's a big wave that you have to account for. And even in responding to the wave, that's where you can model self-care. And so it may look different depending on the season, depending on how big of a wave. But remembering to integrate it, remembering that it's a piece, whatever that looks like, is a big takeaway that we want you all to move forward with. We also want to look beyond what the individual faculty supervisor, the individual professor can do, and really say, but what about at the programmatic level? Because as we noted, there are some systemic factors that may be at work here. So how could program-wide adjustments be made to address self-care, to address wellness, and to help balance out that other side of the coin so that we're not just communicating as a program that you need to engage in self-care so you don't burn out, but that we're also attending to self-care as a way to support wellness. And there's a few different recommendations from across the field about how this might be done. One recommendation that was suggested by Christopher Maris, Schur et al., and I believe there's other sources as well, specify perhaps integrating a course as an elective into the curriculum that students can take that emphasizes maybe an aspect of self-care or wellness as a whole, such as a mindfulness course elective that students can participate in. So it's a part of their class credit, but they're able to participate in mindfulness as a form of self-care or some other aspect. You also can look at ways that you might infuse wellness-based principles throughout various aspects of the program. So this can be done by ensuring that multiple courses all address self-care and wellness in some way. This might sound like a daunting task, but you don't necessarily have to go through and rewrite your entire curriculum. Just looking at the courses you teach and seeing if there are opportunities to talk about self-care some more, to look at topics through a wellness-based approach. For example, we talked about supervision already. So if you supervise master's level students, or if you're a clinician and you supervise interns at your site, how might you talk about self-care and how might you discuss those topics and integrate self-care into supervision? In your ethics courses, if that's a course you teach, really looking at those codes that we've reviewed at the beginning and saying this is a piece of being an ethical counselor, and how might we integrate this into our practicum, into our internship. And then finally, other classes like helping relationships. How might you apply these principles as a piece of the overall topic that you're talking about? Another important thing to keep in mind is that the way the program culture approaches wellness is going to be communicated to students involved. So it's easy to turn self-care and pursuit of wellness into one more demand, one more regimented checklist, one more source of stress. And that's not really the goal of wellness. It's about pursuing wellness as a goal, not pursuing perfection. So self-care is a great tool, but if I find my self-care regimen is making me more stressed, then that might be the letter of the law, but it is not the spirit of the law. So sometimes I have to look at things that are meant to be self-care in my life and say the way I'm approaching this right now is not in a way that's actually benefiting. So it's a tug and pull. Sometimes I'm not going to feel like doing what's best for my health, but I do it because it is good for me. But in other ways, it can become a burden. And if that's the case, maybe I need to examine the way I'm addressing self-care. And for a program, it might be the way it's talked about, assessing how you and your colleagues discuss self-care with students, how you model it in your life. If it's becoming just one more thing versus becoming integrated into the way you work and the way you relate to your students. So we want to do one more check-in here and see what ideas you have about how else faculty, supervisors, clinical training programs in particular might support student self-care. For the students that are in the room, maybe things that you've noticed about particular faculty members that has been helpful for your self-care so that people can get ideas here in this shared space.
And while folks are engaging in the chat, I just want to give a couple of real examples that I've had recently. One was earlier in the semester, kind of looking at both the systemic as well as looking at kind of the idea of being in the moment with some things. So one of the assignments that I include in ethics is that students make a self-care plan. And that may not look the same later when they get out in the field, but it is the beginning of some of the awareness and integration of some of these practices. So that's kind of a structured way of including health and wellness and self-care. Is what might this look like for you, researching and writing on that. A more informal thing that occurred recently was I came into class and everybody just looked really frazzled. Sometimes you could just see the body language, and I had a lot of content to cover, but I felt like at that moment, it would be more productive for us to slow down. We did about a 3-minute breathing exercise together as a group, engaged in some mindfulness, and it was so interesting that I could see how different everyone looked after doing that, and really helping us all as a class to tune into the fact that we needed to attend to where we were at kind of mentally and emotionally. Seemed very helpful, and seemed like we were able to really then attend to the other things that we were doing that evening. So just kind of some structured and then more in the moment things that we can do.
And that's a great example of what we can take to the spheres of influence that we have about how we might model and also explicitly talk about self-care. I see in the comments, Bonnie, you shared about teachers encouraging you to pursue interests that spark joy. That's such a great tie in there. You want to find something that's going to be fulfilling in that way. Amber, you suggested group sessions for student counselors to debrief and find encouragement. That's another great class to integrate these types of topics in group counseling. Whatever that format is you use for that course for your students, finding a way to integrate some self-care conversation as a part of that is a great opportunity. Lauren, you're sharing that your teachers have talked about self-care, but you haven't really done activities. Especially during this time, posting about it would be helpful, I think is what you're saying here. So it's a good opportunity. And sometimes students involved in Chi or other honor societies that you might be involved with, Chi Sigma, Iota, for example, that might be an opportunity as a student leader to bring about some of these activities. If you're involved in groups at your school, you might be able to spearhead some of these activities if you feel like it's not being addressed. Talk about, okay, what about self-care? What are we doing for these students? I'm seeing, Bonnie, you said every class you have a check-in. That's great, talking about those. And a faculty supervisor who expresses concerns about life and school. Yeah, recognizing our supervisees as whole people and being flexible and adaptable. So I encourage you all to glance through the chat because there's so much being shared right now from many of you saying what's working, what your counselor educators are doing. And counselor educators are in the chat as well saying what you've been able to do. Distance learning does maybe challenge this, but you're still using time to check in to see where people are. And I want to encourage as well, it's good to have the check-in, but also find ways to talk about it so that it's the concept of don't just say, oh, how are you? And people say fine and you move on. Find ways to talk about it where you're able to genuinely have honest conversation about what are the barriers, what are the difficulties, and then what's working. Kind of attending to both ends of that experience can really open up the conversation. And yes, sharing honestly with peers about what might be working and what might be difficult is such an important piece to this conversation. So I encourage you to go from today and continue the conversation and to be inspired to keep up this type of conversation with those in your sphere of influence. And in that light, as we've mentioned, because there's a lot of systemic considerations related to burnout, we also want to consider the ways these might need to be addressed from a self-care and wellness informed perspective. So as clinicians, as counselor educators, as supervisors, and as students, it's important that we advocate for our own wellness, and this can be done through personal self-care practice and modeling that for those whom we might be teaching or supervising. But beyond that, there might be times where advocacy is involved in a way beyond just our personal interactions and behaviors. So Dang and Sangyanovich 2015 provide a helpful lens for how advocacy might fit in with the self-care and wellness conversation. And they talk about different levels of advocacy. So there's the self piece where you're engaging in self-care behaviors and you're attending to your own wellness. And that is an important piece because you model for others and you also maintain your wellness for yourself. But there may be times you have to address things at a program level, like we've talked about. There might be times that you have to advocate on your students' behalf to their internship site. I think back on some of my experiences of boundaries being placed by my program when I could, like for holidays, saying no, the students cannot be at this site during these times because that is a break. That's a form of advocacy and gatekeeping on behalf of your students to say, yes, they're a counselor. Yes, they need to fulfill their requirements. Yes, they need to be available and be there. But at the same time, there are breaks that they need, and this is one of them. And that's a way of advocating for your students' wellness. So just encouraging you to be aware of opportunities, whether you're an educator, a supervisor, even a student, as we mentioned, being involved in student groups on campus perhaps is a way that you can advocate for the wellness and self-care of yourselves and others, because there are systemic considerations beyond what individuals themselves can address through their self-care practice that sometimes need to be addressed in order to have an environment that's going to be conducive to wellness and not spurring burnout. So with that, we're going to start our wrap up. We just want to thank you all for joining us today. I really believe that these topics are so relevant for counselors, for others within helping professions, because we can take self-care for granted at times. And in times like now where our world has been turned upside down, it's so important to take that time to care for yourself. So thank you for joining us. We want to give the opportunity for additional comments. You can hop in there or questions that have arisen. Our emails are also available on there. So we want to encourage you to reach out and just thanks for joining. It's been a great and a quick 55 minutes. Thank you all. You're very sweet.
This was great, Melody and Rosalind. Thank you for sharing your knowledge and experience with us. For those who are in the room, information about CEs and recordings is in the program on the last or second to last page. We thank you for joining. And in addition to thanking our audience and presenters, we also want to make sure we thank the sponsor of the virtual conference, which is Tavera. Tavera is great for if you have a counseling program that all of a sudden needs to go remote.
That's wonderful. Thanks so much, Jennifer, for helping us and for facilitating this for us. It's been such a great blessing.
Oh, thank you.
Thank you, everyone, for your thanks in the comments. We appreciate. All right. Any other comments? If not, we'll begin to wrap up because I know we're hitting about that time where you'll have to jump to your next presentation that you're attending. But thank you all and have a great rest of the day. Take care.